I thought this was a good topic for grand rounds in our department because it kind of highlights the success of a real collaboration between radiology and surgery and many other subspecialties, and it really kind of underscores how interdisciplinary programs can be successful and produce quite a lot of good results. So with no further ado, I'm going to turn this over to Hanman, who's going to talk a little bit about the guy who really started it all, Mike Harrison.
The seminal figure, the protagonist of a lot of this story is Mike Harrison, who came here in 1979 after training at Mass General and then at LA Children's Hospital with the vision of starting to do, in addition to the routine pediatric surgery that we do, fetal intervention. At that time, it really met with a lot of skepticism. I think that Mike, when he was a resident, saw a lot of congenital anomalies that really couldn't be adequately treated after birth, and so he said, I'm going to deal with this before birth, and everybody said, wow, you're crazy. And so the paradigm was there are certain fetal anomalies that result from a simple anatomic defect, and because of the resultant anatomic defect, they have consequent disastrous physiologic consequences that continue on. And if you could fix that before birth, you would halt or even reverse that. So Mike started in the late 70s, early 80s, the first fetal treatment center in the world. And again, repairing the defect before birth was sort of unheard of, but he and Roy Philly really created this wonderful multidisciplinary team that we have continued. It was led largely by lots of basic science, small, large animal models, finally non-human primate models that vetted all the parts of fetal surgery that we practice now. And for anybody who knows Mike, I'm sure a lot of you know Mike Harrison, he has sort of just boundless enthusiasm and complete faith in what he's doing. And I think that faith and enthusiasm is really contagious. And I think that is one of the critical parts of our fetal treatment center. There's a lot of disciplines that are involved in our fetal treatment center: surgeons, MFM specialists, anesthesiologists, neonatologists, cardiologists, our social work colleagues and advanced nurse practitioners, and sandwiched on top, we have the pediatric surgeons and the radiologists, ultrasonologists who've worked very closely together for years and years.